Is it playing, right?
Yeah, I can see.
Okay, last time, okay. Or if you want more, I can play it more for you. Okay, you want me to play again?
No, it's okay.
Okay, so right. So just like the sequence which we are using for a video station, just talk in that sequence.
Okay. In this video, I can see an infant appears to be well grown for his age without any background noises coming. Lot of background noise. Hello. Can I start now?
Yes, start now.
Okay. In this video, I can see an infant who appears to be well grown for his age in a probably a home setting. And I would like to plot his weight and height in the growth chart. There are no obvious unusual features, facial features. I could see that he is sleeping, and during his sleep, he is moving his both upper limb and lower limb. But this movements has not disturbed his sleep.
Okay.
So I would like to take a history of the
No.
onset of the
Okay.
next
So
maybe I can
what two question in history? Okay. So what two question in history?
the two questions I would like to history is about the movements. Do they occur only in sleep, or do they
Very
occur
good.
apart from sleep as well?
Yeah.
And can these movements they be stopped by touching him?
Mm-hmm.
And shall I say more questions or just two?
Yeah, two are enough actually.
Okay. And
Okay,
whether this
I think Dr. Barnali, I will stop here. I will like to stop you here because I want someone else to try this as well. Okay, then collectively I will talk to both of you. Okay, so is there
okay.
anyone who is exam going candidate and who wants to try this video? I'll play it again because many people joined late. Anyone who wants to give it a try, who is going to appear of recent? If nobody is there, then we will continue with Dr. Barnari Das.
Can I do, Dr. Tahir?
Yes, who is there, please? Dr. Yaz.
Dr.
Okay.
Riaz. My name is Dr. Riaz.
Okay.
Uh,
Okay, I'll play this video for you because many people they joined late, so maybe they would like it. Okay. Okay, I think that's enough. Okay. Yes, Dr. Yaz.
I can see infants who's looking well, not in this market. He is sleepy. I think he is in home setup. He has some jerky movements in the upper and lower limbs, but which is not disturbing him. And surrounding is nothing. So this one, I cannot see age, so I cannot comment that he is well grown or not grown.
Okay, he's 24 days.
So he's well grown, yes.
Okay. Okay, so what two questions in the history you will ask?
First of all, I can ask. I will ask onset, duration,
Okay.
and also some birth history, that he has any birth, at the time of birth he has any abnormal history. So
Okay.
I will ask birth history.
Okay. After that, what is your most likely diagnosis for this condition?
Should I say or should he say,
No,
Dr. Tahir?
first let him finish, then we'll come to you.
This may be infantile spasm,
Okay. What is your most likely differential? Tell me one differential.
infantile spasm.
Okay. So, okay, I'll stop you here. Okay, Dr. Barnali, now you continue.
Okay, my two differential will be benign sleep myoclonus, second will be jitteriness, and third will be most unlikely any seizure disorder.
What will be second one?
First one was benign sleep myoclonus, second one is jitteriness.
Okay, jitteriness, right. Okay. Okay, so how you're going to investigate to reach your diagnosis?
For investigation, first, I would like to have a proper history. Then I would examine the child. And if I don't get any history or examination suggestive of any neurological disorder, any seizure, I would consider it as a benign sleep myoclonus, which will go away on its own. And so I will not investigate the child anymore. But if it is a case where I get indications that it might be seizure, then I would go for further investigation. If any examination and history suggests of seizures, I would like to then follow investigations.
Okay. Which you said that this is more your second differential will be jitteriness. So how you will differentiate that to whether this is jitteriness or this is seizure activity?
In jitteriness, when we touch the baby, the movements will go away, but in seizure, these movements won't go away. This is clinically and mainly clinically, and investigation-wise also we can have a difference in jitteriness where there will be
clinically. Tell me clinically.
Clinically, yeah. On touching, the movements will be stopped, can be stopped by touching, but not in seizures.
Okay, anything else? This is
and
one point
jitteriness,
you told.
And jitteriness will not affect the baby's feeding, or he will not have any other abnormal body movements, or will not affect the vitals. But seizure disorder will affect the vitals.
According to neonatal guidelines, tell me what is the difference between jitteriness and seizures? Because we'll be talking about guidelines, not anything away from guidelines. Okay, anyhow, the parents, they are very worried. Okay. So for example, this is benign neonatal myoclonus. So what you will tell to the parents? They're very anxious.
Okay, I will tell to the parents that this is a benign condition, and it will, since it occurs only in sleep, and his sleep is undisturbed by these movements, it is unlikely that the baby will have any harmful effects from these movements, and the baby will outgrow of this movements. Baby will outgrow these movements.
When?
By around 6 months.
Okay. And doctor, are you sure that this is a benign neonatal myoclonus, or you want to do some investigations?
No, I don't want to go for investigations. After proper history and examination, the baby appears not to have any other underlying problem. So this is benign sleep myoclonus. So I will not go for any investigation. But if this becomes very frequent, we will again observe him.
For example, this is seizures. So how you are going to proceed with investigations?
If the parents have brought the baby with these movements and they appear to be seizures, the baby has to be admitted and the baby has to be investigated for seizure. My diagnostic investigation will be an EEG. And second line investigation, EEG and other investigations would include blood counts to look for any underlying infections, inflammatory markers, electrolyte abnormalities, mainly the calcium, sodium, potassium, then blood glucose, And after informing the consultant, I would also like to do an imaging of the brain, since the baby is only 29 days old. So ultrasound of the brain will be possible.
How you are going to treat him if these are seizures, for example?
If these are seizures, I would, after involvement of my consultant, I would like to start with anti-epileptic drugs, maybe most favorable, most used anti-epileptic drug in newborn babies is usually phenobarbital or phenytoin or levetiracetam. But this will depend upon this will be decided by the neurologist, involvement of the neurologist and the consultant.
Okay, thank you so much, Dr. Barnali. Okay, so just you can see these seizures. You can see the book, right?
Yes, 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 yes.
Okay, Dr. Barnali, you are right, spot on. Okay, very good. Okay, so this is actually the guideline differentiation between jittery. This is blue book, by the way. So this is jitteriness and this is seizure. So stimulus will provoke jitteriness, but it won't provoke seizure. Very important point. The second one, you said that when movement cease when the limb is held in jitteriness, but they will continue in case of seizure. Okay. Jitteriness can occur in awake or I mean, the conscious states may be awake or asleep, but in seizure that will be altered. Not important. But eye deviation in jitteriness is not there, but usually it is there in seizures. So these two, three, they are very important. You need to know. When they ask you that, for example, this is a seizure, so what type of investigations you are going to do? So the first line investigations you set correctly, but haphazardly. But anyhow, you set correctly. I'll give you full marks. Blood glucose, electrolytes, blood gas, culture, CRP to rule out infections, as you said, ammonia, urine toxicology. At least you should say three, four things. Biochemistry should be on the top. Okay. And after that, the second line investigation, you correctly said, brain imaging, and for higher investigations like metabolic screen, and also pyridoxine dependent seizures are very important, especially if the mother has taken many Vita-6 tablets for this pregnancy vomiting. Treatment, ABC, then treat the cause, whatever may be the cause, just treat that. And for example, if that is secondary to hypoglycemia, then how you treat. If it is secondary to hypocalcemia, then how you give calcium. If secondary to hypomagnesemia, then how you treat that. So these all should be on your fingertips. And if that is a pyridoxine dependent seizures, then how you treat that. Okay, so this is very important. You need to just go through all of them. Okay. Okay. What is prolonged? If it is more than 2 to 3 seconds, then you call it as a prolonged neonatal seizure, 2 to 3 minutes. That is a prolonged neonatal seizure. And what is frequent? If it is more than 2 to 3 per hour, then it is called a frequent neonatal seizures. Okay. And drugs, then you have a lot of drugs and anticonvulsant, like you have the phenobarb, which is the best drug anticonvulsant for neonatal seizures. Then you have the phenytoin, midazolam. So you just need go through all of them. These are very important. Okay. I just show this video just once for everyone who joined late. Just see this. This is benign neonatal myoclonus. Okay. This usually happens in neonates. Sorry, it usually happens when the child is asleep. It usually starts in the second week of life. You can see it's myoclonus, typical myoclonic seizure, and mainly it involves the upper limb. Mainly, if you see the jerk stroke, usually it is more in the upper limb as compared to that of the lower limb. Exact pathophysiology is not known, but it is said that is actually a sort of a REM sleep. Okay, in REM sleep, usually you have myoclonus, so it's actually the same thing which you see. But the thing is that it's not affecting the brain. and the parents usually they rush to the physicians that their child is having seizures. Okay, it appears disappear usually by around 6 months in almost 195 to 100% of the cases. Okay, um, and usually no treatment is required. Just what you need to do is to do the counseling. Okay, so that was all about a very good case. We just received one case and I just wanted to share that with you. It's a real video. Okay, I think thank you. So we'll be just hanging around just like this whenever we have a good case, and we'll be discussing and sharing that with you. Okay.